just go in here.
Now close it.
Yeah.
And pull it out. Okay, very nice.
59. So is there a particular score that you have to get before you're let loose on real patients?
Well, 100 is good.
100, okay.
Oh, wow.
Yeah?
Here we are.
Yeah, so you can actually sleep.
I think that's actually, it's actually quite comfortable.
$285 million people are blind or visually impaired worldwide, and 90% of those live in developing countries. And yet, with the right eye care and medical interventions, 80% of visual impairments could be prevented or cured. I'm Dr. Joff Lacey, and I'm in Zambia to meet the team of Orbis and the Flying Eye Hospital. The Orbis Flying Eye Hospital is an aeroplane that's been converted into a fully functioning surgical and training hospital, which travels to developing countries worldwide. The Orbis team has been working here in Zambia, one of the least developed countries in the world, since 2010. Hi, Zambia.
Hi, Jeff. Welcome to the Orbis Flying Eye Hospital.
Thank you very much. Thank you for letting me be here.
It's exciting.
Very exciting.
Go and take a tour?
Absolutely. Let's go. Let's go. The plane has a fully equipped operating room alongside a laser treatment area, a multimedia classroom, and interactive training facilities. Richard has been brought in to have corrective surgery on a squint. This relatively simple operation will have a huge impact on Richard's ability to perform well at school and therefore his prospects for the rest of his life. It also gives a local doctor, Cheleshe Mboni, the opportunity to work alongside his mentor, Larry Benjamin, one of the UK's leading eye surgeons.
So you'll see over there at the far microscope, Dr. Mboni doing the surgery together with Dr. Benjamin.
It's amazingly well equipped. It's a proper modern, full-on theatre. You don't really expect it when you come onto the plane. It's incredible.
I wanted to show you another interactive feature on the aircraft.
Yeah.
Is this monitor over here. So we have 18 cameras on board. So we have the opportunity of broadcasting everything that's happening in the main operating theater to the front classroom.
And is that the surgeon's voice?
Yes. So the surgeon doing the surgery is wearing a microphone.
Yeah.
So during the surgery, he's explaining the procedure step by step to the front classroom, and also gives the ability of the participants and the trainee doctors to ask questions.
It opens up the theatre to another 48 people in the class.
Exactly.
Amazing. Dr. Mboni, Richard's just had the operation. How did it all go?
Yeah, it actually went fine. We were trying to correct the squint which he had.
In terms of, for your training, had you done many squint surgeries before the involvement with Orbis?
Actually, most of the squints that we did during training was observatory, just watching what somebody was doing.
I see, okay.
Yeah, so these hands-on has really come with Orbis.
To date, the Flying Eye Hospital team has trained medical staff and performed surgeries in 78 different countries. One of the most important procedures that they teach is cataract surgery.
Cataracts occur when areas of the lens become opaque due to a change in the structure of proteins within it. This prevents the normal transition of light through the lens, making vision blurred or misty. Over time and without treatment, the cataracts may grow larger, leading eventually to blindness.
This is one of the major problems that Orbis deals with in Zambia. And essentially the problem is that your lens, which sits just behind your pupil, goes from being totally transparent to a bit cloudy and therefore impacting your vision. And there's a nice way to demonstrate this. So if at the moment you have normal vision, and then with the cataract, the vision degrades to that. So you can imagine the impact with surgery when it returns to normal.
Here in the corner, we have another unique tool of our ongoing training program. It's what's called an eye simulator, and I want to introduce you to Dr. Gabriela.
Hello, hi, nice to meet you.
One of our staff ophthalmologist who's going to explain
great.
to you what the eye simulator does.
Okay.
You want to try?
I'd love a go, yeah. Here's my patient. Good.
Here's your patient.
Luckily not real.
this is our eye simulator.
Yeah.
You're going to grasp the triangles and put it in the center. If you go too low, you hit the lens and get the cataract. If you go too high, you damage the cornea.
Okay. Okay.
In the countries that we visit, normally they don't have a chance to
try this before
going into a real eye. They use like pig's eyes, dog's eyes.
I'll just go in here. Done.
There you go. Now close it.
Yeah.
And pull it out.
Withdraw.
And we're going to see your score now.
Okay.
Okay, very nice.
59
out of
59%. I'm nearly there. So is there a particular score that you have to get before you're let loose on real patients?
Well, 100 is good.
100, okay. Before I leave, I meet a group of women who have all had cataract surgery. So she was totally blind. She couldn't see anything.
She couldn't with one eye. She was only using one eye.
And then did she have surgery on the plane?
Yesterday.
Yesterday?
Yes.
Were you the lady who was dancing just now?
Yes, she is.
Because you're happy?
Yes.
Can you teach me to dance? Come on. This is happy dance. I like it. I like Zambian dancing.
Children with disabilities are less likely to receive healthcare or go to school than their able-bodied peers, according to a report by the Children's Fund UNICEF. The report calls for more effort to integrate children with disabilities into society and points out that disabled children flourish when given the same opportunities as their peers.
In Kenya, access to healthcare is a huge challenge. With only one doctor for every 10,000 people, many in rural areas rely on an army of community healthcare workers. But with long distances to travel, poor roads and limited transport options, these volunteers struggle to meet the population's need. I'm Dr. Javed Abdumunem in Kisumu, Western Kenya, where a new scheme is making healthcare speedier and more efficient. This is one of Kenya's poorest regions with high rates of HIV/AIDS, malaria and child mortality. Community health workers are usually volunteers with basic medical training. They perform vital frontline tasks like checking whether children have been immunized, spreading health information and referring patients to hospital.
In this our community, we have around 16 villages, and these our households keep on increasing.
Total population, it's just broken the 12,000 people mark. So who do you have sort of medical professionals dealing with 12,000 people?
Okay, we have one doctor.
Yeah. One doctor?
Only one doctor.
It's obviously there, you know, ever-improving rates of immunization, but still a little bit more to do.
Why the number is below is the challenge that we got about the means of transport and whatever. To move from one household to another, or to move from one homestead to another.
Here we are, busy, very busy. The solution is simple. Equip the healthcare workers with bicycles. Clifford.
Pleasure to meet you.
Hello, how are you?
I'm fine.
Thank you for having me.
Yeah. COPE Africa came in with a project called Bike for Care, and this project aims at giving community health workers bicycles so that they can easily access the households and also easily access the hospitals.
The Cycling Blue workshop can recondition 50 to 60 second-hand bicycles in a week. Okay, another number 8, fantastic. I feel like an orthopedic surgeon right now, using some nuts and bolts and screws, and so we're actually giving this bike a new lease of life. So this is our red and white healthcare bike.
Yeah, this is a bicycle when it's complete. This bicycle, apart from just ferrying the community health worker to the hospital and to the households, you can also attach it to a bicycle ambulance.
There it is. Yeah. Oh, wow.
Yeah?
Here we are.
Yeah, so you can actually sleep.
I think that's actually,
so like I told you earlier, you can take an expectant woman to hospital. Most cases, they use a bicycle or a motorbike, or at times they even use wheelbarrows.
Really?
Yeah.
Wheelbarrows to transport patients?
To transport patients,
I think this is better.
Yeah.
Slightly treacherous. And we're actually finally delivering these bikes to the dispensary in near Lunya.
Yeah.
Near Lunya. About 5 kilometers.
Madam Mildred Ogola.
With the delivery of the bicycles, the issue of people not accessing healthcare services for HIV treatment and TB treatment will be a thing of the past. Don't we? Yeah. Is it?
It is a good one. It's a good one? Actually, it will make the work easier now. Let me try it.
Yeah, go for it.
Yes, let me try it.
But before they head off, inevitably, there's some paperwork to get through. Oh, look at this question here. What distance do you cover doing home visits in a day? And you've written on Monday you cover 12 kilometers. On Tuesday, 14.
On Wednesday, I covered 10.
10.
Yes. I go to an account, and then I'm going to leave you. Actually, there's a caregiver that I promised that I will visit that caregiver today.
Why do you not use the term parent?
We have orphans because of the HIV AIDS.
I thought so.
Yeah, that infection. It came and then so many parents, they succumb to the disease. So we use caregiver as a general term.
When Kennedy gets a call, he's got to go. Going to the left? We head to a village a few kilometers away from near Lunya. What did she say?
And that she wants a t-shirt.
Ah, she wants a t-shirt.
I want to buy a credit here. I want to buy some credit.
As well as working unpaid alongside his regular job as a welder, Kennedy has to cover essential costs like phone credit.
I have to assure her that I'm coming.
Right, here.
We want to build trust. If you don't make that appointment, then you have breached the trust.
Right.
Lena, Moscom Ketirito, yo nyalo Car Baptist ka.
Being local, these healthcare workers are known and trusted by their patients. And this is your own community. You live around here?
Yes, I come from down there.
Yeah?
Yeah.
So, in fact, you might have known lots of these people before?
Yes.
And why did you become a health worker?
Actually, my sister died because of HIV.
Oh, I'm sorry.
Then,
that's why you became a health worker?
Yes, I said that I need to help my people. I can
understand that.
My people, because actually many people are dying.
With an average life expectancy of under 50 in this region, adults are often left caring for a large number of family members. A key part of Kennedy's role is supporting these caregivers. Today, Kennedy is visiting Lena, whose sister is in hospital after an operation for cervical cancer. How are you?
I'm fine.
Thank you for having us.
Okay.
First, Kennedy checks the health of the absent mother's children. Also, it looks like he's looking for anemia in the inside eye of Eunice.
A lot. Eunice ate ugali and vegetables, so she's telling me that she ate ugali and vegetables, and now she's satisfied.
Excellent. She's got a full stomach.
Yes.
Huh?
With them, they don't have any problem that I can say that this one needs my attention so much or needs referral, but I can see that they're healthy. They're healthy.
The children's mother, Emily, is due back from hospital tomorrow. Kennedy will need to return regularly to check her progress.
So how is she doing now?
She can walk slowly, but by handling her.
Yeah, if you get hold of her.
But she's still weak.
If she's discharged from the hospital and back home, then I'll just make a frequent visit in this house. Yeah, so that I may see how the wound is healing, how she's improving, and then if there's something that we can do to help her or regain strength, then.
All this going and coming, you would do on the bicycle now?
I can frequent myself as many times as possible because I have something that facilitates my movement.
I'm very proud about the bicycle. It will ease his work because sometimes I feel like giving something like transport, but I don't have.
No, you don't have it.
Yes.
Okay. Oh. It's a caregiver?
No, this one is my mom.
Oh, it's your mom. I'm in near Landa, and I think I'm expected by 2 community health workers who received their bikes about a year ago. Hello.
Hello, I'm Pauline.
Pauline, hello,
Yes.
I'm Javid. And
I'm
this must be
Mira. Nice to
Mira.
meet you.
How are you doing? Here we go. We've got a few minutes before the rain comes, apparently. It looks very ominous.
We can visit 10 clients in a day.
Wow, how many were you visiting before the bicycle came?
Before the bicycle, we can, if more, only 3.
Only 3? The patients that Marib and Pauline visit are bedridden patients, and they're stigmatized by the HIV. So they're HIV-positive patients who are at the end stage of their disease and who have no support network. And that's what these community health workers do.
Some can't take even the drugs the way the doctor directed. So we go there, we first boil water and wash the mouth. But the main thing is who don't want to take the drugs because of they don't have something to eat.
Because they don't have something
Yes.
to eat. The prevalence of HIV/AIDS in this region is 14%, twice the Kenyan average, and 80% don't know they have it. This used to be the case for one of the lady's very first patients, Margaret.
The ill was just going on and on and off, on and off. Then I asked her, how are you? How are you doing? Have you gone to the hospital to know your status? Then she said no. Then I tell her, no, just go to the hospital and there you'll get your status.
I went to KDH hospital. I was tested and I was diagnosed with HIV positive. So I got information on how to stay positively, live positively. I have undergone so many trainings, and that brought me to have hope. I really appreciate the two of my friends. They have brought me from far.
I'll teach them.
That was quite close. Is this usual? Yeah? Come rain or shine, we are cycling. Bye, Margaret. Take care. Thank you. Bye-bye. Click. Go on. And another one. Thanks, guys. Thank you very much. I think standing here in the rain is pretty amazing. To think back on the last couple of days I've had with the community health workers, Kennedy and Pauline and Merab there on our bikes, doing what it takes just to deliver the healthcare that's necessary in this these difficult environments. My way home's that way, so I'll be off faster than the rain.
A musician has been filmed playing the guitar while undergoing brain surgery to reduce tremors. Brad Carter from Los Angeles was filmed having a pacemaker fitted to help reduce fear of the operation among future patients. Brad's tremors went away when he carried out certain tasks like playing the guitar, and keeping him awake helped doctors pinpoint which part of the brain to target.
A key element of the Orbis program is to work with local medical staff using local facilities. This ensures that even when the plane is gone, the much-needed specialist eye treatment can still be provided. In Zambia, this training is done at Kitwe Central Hospital, where Dr. Mboni works. Are children's eye problems, visual impairment, is that a big problem in Zambia?
We have over 30,000 children with visual impairment in the country. Since Orbis came to Kitwe, they provided us with what we needed to actually set up the only pediatric eye center in the country.
This is the only eye hospital, children's eye hospital in Zambia?
Yeah, this is the only one that we have.
3 young sisters have travelled over 16 hours by bus with their mother to receive treatment from the Orbis team. All 3 suffer from varying degrees of cataract-induced blindness, which has caused them to fall behind at school.
Oh yes, I can see. Oh yes.
2 of the sisters are now recovering from their surgery. So we're just in the main hospital now, just to go into one of the wards to meet Lucy, who's the 3rd child of the family who's having a cataract operation this afternoon. So come this way. Hello. Molasheni, Lucy, hello. Lucy, what's your favourite subject at school? What do you like to learn about?
She likes English.
English. How is your English, Lucy? 1,
2, 3, 4, 5, 6, 7, 8, 9, 10.
Fantastic. So the issue Lucy has is that she has cataracts in both eyes, and it appears as though she has normal visual ability, but in fact it's significantly impaired, so much so that it's had a real impact on being able to go to school and her lifestyle at home. So with the intervention this afternoon and with the right medical treatment, she may be able to make a real positive impact on that.
Hello, Lucy.
This surgery is another opportunity for doctors Benjamin and Mboni to work together.
You all right?
Yeah, scared.
So they're all set to go in theatre. She's now fully asleep under general anaesthetic. The surgeons are scrubbed and set to go, so let's go and see how they're getting on. During the operation, the cataract is removed through a tiny incision in the eye, and a synthetic lens is inserted.
No, I'll just use the phaco blade, 15 degree, and the phaco 2.75.
You can see on the screen there that the new synthetic lens has returned that transparency to the pupil, and therefore should provide a good outcome for Lucy. How are you? You okay? Good.
Okay, Lucy. You see, that's it. That's it, that's it.
No. I think clearly overwhelmed by the situation, but we'll see what the assessment shows now.
Come here, please.
So, Dr. Mboni, what are you looking for with this examination?
Yeah, it's just to see that the cornea is clear and the eye is not collapsing.
So the point at which you inserted the new lens?
Good. Yeah. They are done. Can you just... No.
So far, it looks like she's got them all right. And they're just going to the smaller sized objects now. The improvement from her pre-surgery test is dramatic. It really is amazing.
She was able to see just these figures.
That's all she could recognise before the operation. Okay.
And now she improved to be able to see this.
That's incredible.
Yeah.
We know. We know. It is. High five. Woo. I'm doing my best. I think she's very happy though. It's just my face that she's not too happy about seeing. So I've come to the end of my time in Zambia, and what's been wonderful to witness is this very special relationship between Orbis and its local partners. And the success of this project has been plain to see in the stories of Lucy and her sisters and the hundreds of thousands of people worldwide who have had their sight saved and their lives changed. Lucy! Woo!
We'll take you off there. Couple of big breaths in and out for us. Just so Chef would find that absolutely fine. That's the kind of level you'd be if you're intensive care. And we think things like how you respond to low oxygen is probably key to why some people survive in intensive care and some people don't.